just want to thank you all for being here. Thank Project Karinu, the other partners, the parents, and the kids really for being here. We'll spare ourselves from going around again in introducing ourselves. I think we all know who's here. But I do want to, of course, just introduce again my assistant today, Jimmy Clark. He's 4, right? You're 4? That's right. So we'll hear a little bit more later from his foster parent, and of course, as we go along with the presentation, hear about the success stories of this program. Okay, Senator Aline Yamashita as well was joining us, and I know she's watching. So thank you, Jason.
Thank you, Senator. We'll go ahead and this thing should work. Past that during the practice run. Just real quickly, just sharing with you what the presentation will involve in. We'll provide the big picture of the program, who we serve, what do we do. We'll have an opportunity to hear from our partners throughout our community, and we'll also look at some evaluation data, and most importantly, we will then go to the family voice. We'll save the best for last. We have a few families, and if you can open up the opportunity to other families who may be willing to share their experiences working with Project Karinu. We look forward to them being added on as the families share their experiences later. And finally, we'll be able to share some of the ongoing efforts to continue such a wonderful program. I believe that one. There you go. Okay. I guess this short clip. Senator, you say your son's not here, but I think you'll see him in a few seconds.
Social, emotional, and behavioral wellness of young children. Loving our babies means emotionally and socially strong teenagers and young adults.
Loving our babies means a healthier community.
Loving our babies means stronger families. Loving our babies means happier homes.
Loving our babies means a better and brighter future for Guam.
Thank you. So Terry was here. Thank you again. We just wanted to share that with you, and again thank you and our other leaders throughout our community who were willing to help out in our public education and awareness effort. This is one of a handful of outreach activities we do plan, and what a way to begin this conversation by starting off with the leaders that we will be seeking your support for this program. I apologize. And Ms. Bonnie.
We thought we'd start out by just giving you the big picture about where Karinu came from and why we even thought this particular type of initiative was important for Guam. Public health was initially funded in 2009 for 6 years for Project Karinu grant, which is from the Substance Abuse and Mental Health Services Administration. It's a very competitive grant. It was one of 20 sites funded, and we were one of 3 early childhood sites. So several consultants who have been to Guam have called early childhood systems of care the new frontier, because it really is a merging of what we've known for some time through Ifamagunta about children's mental health being delivered in a certain way, and the merging of early childhood systems change, which has been since 2000 spearheaded under what is now the Guam Early Learning Council. So we're bringing those 2 initiatives together. It is a children's mental health initiative, and it is to develop and implement an early childhood system of care. Because it's a cooperative agreement, it's a little bit different than a grant. Senator, I think you're familiar with that, and we have very specific requirements, and we can provide more information about that. Its governance is provided by the Guam Early Learning Council, which is established in statute through Public Law 3162. And the Guam Early Learning Council is responsible for all early childhood programs that service children from birth through 8. So that's why we're nested under there. Just to give a little bit of background about what we're talking about when we say an early childhood system of care. really talking about a framework or a philosophy about the way services should be delivered. So it's not a place, it's not a single program, it's not a single agency. It's a framework for how we coordinate and integrate services so families don't get the runaround and they get the help they need through one place. It's also community specific, meaning it might look different on Guam than it looks like in California or Washington, D.C. or Oregon. And in the lower corner of the slide, you'll see what is our conceptualization of our early childhood system of care. Last April, many of the people in this room came together to talk about what was the foundation for our system, and so you'll see the laddies, and on those laddies are all the values and principles that we hold for children and families, and then the different components. And each one of those boxes represents either a program or a service, and we're hoping to show that they're all around the orange circle in the middle, which is our children and families, so that we are building a system that serves their needs by bringing different partners to the table. A lot of people ask if it's a mental health initiative, why did it get positioned within Department of Public Health and Social Services? And so I just want to take a minute on that because I think it's a really important point. When the grant was first being written, a lot of thought went into where do families first show up when they're looking for help. And most families, or quite a few of Guam's families, get their primary care services through the community regional health centers. And so when they go in for a well baby check, or even prenatally when they're coming in for care, they're already building that relationship with their primary care staff. So we thought it would be a point of easy access. It's also the point where parents come in for WIC and other supportive services around young children. So number one, ease of access, natural entry point into the system. The other factor was that if you look at who are key collaborators within an early childhood system, our partners are a little bit different. They overlap, and I really am so pleased to see that Annie's here because we really are one system and we overlap. But there are some things that are unique to the early childhood piece. And one is our partners are different. So, for instance, Estella's here as a child care provider. Most of our partners are in the early intervention system within the Department of Education, and then Child Protective Services is one of our major partners. And so you can see that those partners are housed under the Department of Public Health. And lastly, we figured for new families who were just getting used to the idea that maybe their child's development was not going as expected, that it would be less stigmatizing to first get services here where they're already in relationship with people through primary care. So that's kind of the why behind that. Just another couple points at a national level and a best practice level, there's been several movements, and one has been to really look at providing mental health within a public health framework. And that doesn't necessarily mean at public health, but it means focusing on health promotion, prevention of problems, and treatment rather than just treatment. And so public health already embraces that model. And then there's this national priority about integration of primary care and behavioral health. So that's kind of how all that came together. So before we get into hearing from the program and families, I just wanted to give you a definition of what we mean by early childhood mental health, because a lot of people think, oh, young children, they don't have any problems, they're babies. And what we're talking about is the social, emotional, and behavioral well-being of infants, toddlers, and their families. Notice it includes the words families because nothing happens to babies without their families, and so that relationship is so important. And so it's the capacity for children to express emotions. They have a full range of emotion. I think you have young children, so you probably see that. To form close, secure relationships with their caregivers, and to feel safe enough to explore their environment so that they can learn. There's another definition of early childhood mental health that really focuses on strategies, and I just want to mention one thing. The key to that definition is giving families what they need to be effective parents. So it's not just a treatment for the child, it's really supporting the whole family. know what mental health for young children is. Why is it important? And, we're not going to give you a big lecture here, but the recent research in how children's brain develop is really amazing. And it's telling us that early experiences literally form the architecture of the brain. So the number of connections in the brain, the number of healthy areas within the brain are a result of the interactions that a young child experiences. And so this is such a key period. The other thing that we know is that all kids get exposed to stress. Stress is a fact of life. And a certain amount of stress is good, but when stress becomes too much for too long, it's what's called toxic stress. So unresponsive or inconsistent caregivers, so our children, many of whom have been victims of maltreatment, but it also includes things that just happens in the course of growing up, an illness in the family, a deployment, homelessness, or the results of poverty. And so all those things can have an effect on the developing brain, which is why we want to really get in early and provide extra supports for children and families. People that say that little kids don't have mental health and behavioral problems, well, the data says that between 9 and 16% of children under the age of 5 have some sort of behavioral health problem. And so that was surprising to me when I learned that. And this just gives you a picture of the kinds of problems that kids have at what ages. And I think you don't need to understand the graph, but the takeaway message is that there are mental health problems that exist in young kids and exist in older kids, and they don't look that much different. The long-term impact of that, however, is really significant because young kids with behavioral health problems are less likely to succeed in school. And so one of our goals for Project Karinu is to have kids be healthy, happy, and ready to succeed in school. Because we know that if they are experiencing social emotional problems, that their later school performance is going to be impaired or could be impaired. Kids with behavioral problems as preschoolers are more likely to be rejected by their peers and be bullied. They're more likely to have negative interactions with their teachers, and this is across their school career, have negative family interactions, and experience failure at school. And then they're also at increased risk for physical health problems. So the need for Project Karinu is immediate, but also long-term. The good news, and we always end with the good news, is that the research also shows us that the brain is very resilient and responds very quickly to intervention and support. And programs like Project Karinu, parent training, high-quality child care, and early education experiences really do make a difference. And as a senator, I'm sure that the bottom line return on investment is part of the picture too. And recently there's been research that's looked at for every dollar invested in early childhood intervention, what's the rate of return? And a very famous Nobel Prize economist, James Heckman, actually did the math on this, and he said the return is somewhere between 7 and 16%, and nobody gets that anywhere. And so I can provide you with those references if you would be interested in that. And I think Lily's going to talk about the kids that are served.
Most of them are males. Almost half are females. They're roughly about 3.5 years of age, and 11% of them are under the age of 1. The 3.5 years of age is probably because they'll age out of Guam early intervention systems and get referred over to Project Karinu. 47% of the children who are referred to us are referred by their caregivers. Most of our referrals come from CPS. Primary care is about 1/3, and then, as I mentioned, Guam Early Intervention. And primary care is not just in public health, but also we have pediatricians out in the community who refer children to us as well. Most of our kids are Chamorro or Chamorro mix, almost 75%. We have about 7% Chuquis, 3% Pohnpeian, 1% Palauan, less than a percent Yapis, a little over 5% Filipino, Filipino mix at 3%, 0.5% Korean, Chinese, and other. When we look at child welfare involvement, again, another reason to keep Project Karinu in the Department of Public Health and Social Services, 16% of our kids are wards of the state, meaning to say they've been removed from the care of their natural parents and are now the responsibility of the government of Guam. Again, that's 16%. 44% of the kids are receiving some sort of investigation or assessment from Child Protective Services. About 35% are in foster placement. Another 16% in kinship care, someone that is known to them. And then about 9% are court-ordered in-home services. So what we're seeing is an increasing involvement of the government in terms of caring for children. Again, not a very good sign. And if we're curious about, like, so what do we look for? What do the risk factors look like? This is what we see. About 47%, so almost half of the children that we serve live with someone who's depressed. 32% live with someone who's abusing a substance, and sometimes this is just one substance. Sometimes it's two substances. We have a lot of kids whose parents are alcohol abusers or ice users or both. About a third of our kids have witnessed domestic violence. About 26% have lived with someone who's convicted of a crime. 14% experience physical assault, and about 8% or 10% have themselves experienced sexual assault. And what do we do with these kids? Go ahead.
Excuse me, I just wanted to clarify, if you could go back to the CPS slide, Lily. And I apologize because I probably should have put this footnote on this slide. Senator, I didn't want to give you the impression that 44% of all kids in Project Karinu were being investigated. This is of families that reported that they were already involved in CPS at intake, the breakdown of the type of services. So it's only about a third of the families that are involved in child welfare. I just want to be clear about that. Thank you.
Thanks, Bonnie. So what do we do? And we get that question a lot. So what exactly do you guys do? We've had to date, and mind you, we've not even been in operations for 3 years. On June 1st, it'll be our 3rd birthday. But to date, we've had 381 referrals. Of those referrals, 221 have completed the paperwork for the national evaluation, and that's where we draw our data from. Some of the families have opted out because this is voluntary. They're not required to be a part of the evaluation. Usually our military families opt out. They don't want to be a part of the national evaluation, or sometimes we'll have executives that bring their children in. They also prefer not to be part of the evaluation, or families that are moving, they'll elect not to be part of the evaluation as well. And of the 221, 184 are eligible for the national evaluation, not eligible for Project Renew services. And so this is what happens. We have 57 who are currently receiving services. 17 of those are probably the highest care. We call them our wraparound cases. And we have about 31 who are receiving family services, and 9 who are at the base of our service delivery triangle who are receiving what we call universal services, and I'll share a little bit more about that in a few minutes. We have 4 children who are on the wait list, 3 who have started the eligibility process and have yet to complete it, and we have 25 families that are awaiting orientation. We do orientation once a month at the second to the last Tuesday of the month from 2 to 5. So this is what I was talking about with services. We have at the very, very top in the red the 17 children, and then we have a portion of those children that receive intensive clinical treatment. As Ms. Capas was sharing earlier, they'll receive play therapy. So not all of our children receive play therapy, just those that warrant the services. And that most of our cases are the bulk of the triangle at the 31 cases. Their families are involved in the care. And then we have our universal service plans. We have 9 of those children right now. They're short-term cases, and a good number of these cases are coming from the Head Start program. Usually they're requesting for assessments and evaluations, and we'll turn those reports out, and then those reports will be used to develop individual education plans for children. And then of course we can't deliver services without the workforce, and I am happy to say, Senator, that since the inception we've had 3 RAP coordinators who have completed their requirements for licensure. So we have 3 local gals, and they're now licensed as individual marriage and family therapists and working towards certification as play therapists. And we have 2 of them in the room right now. I'd like to ask them to stand. Jobeth Aquino and Lavina Camacho, please stand. So it's important to know that we're not just delivering services, Senator, we're also looking at building capacity, not just with our parents, but also with our local folks. And so I want to thank you for your time, and I'm excited to hear about what our partners have to share.
I guess if you're okay with the Senator, if we can use this opportunity to hear from the agencies, programs that we work closely with, and of course we have CPS and we have our parent groups, and I saw Ms. Leon roar. If we can just take a moment, the next few minutes to just hear what they have to say, and Ms. Capas, if you want to share anything, any additional comments.
I'm Stella Gapas, and I'm from PNG Child Care and Learning Center. For several years now, we have partnered with Project Karinu, where we service children outside their agency here. And so what we do is we offer a lot of fun things, which is a different learning environment and also a different learning structure. So we offer things like play, games, puzzles, everything that has to do with the learning domains, okay? So you do a lot of painting. The kids just love to paint and create artwork and crafts and so on. All of these things are brought home. And so we have also group games for them, okay, that's going to help them with, with not only their social emotional, but at the same time, just group play, learning to be able to play with others and talking at the same time. So that also encourages language development. So those are the things that we do for them on certain conferences for parents or parent cafes or respite care. But there's one particular something really, really important for me that we have done for this particular child, and this child is no longer with us. We had him since infancy. We noticed as he grew older, he had a habit of using different parts of his body to hurt kids. And so we referred him to Project Karinu, and immediately there was an improvement, okay, and we were very happy, okay, and so as he was working with a play therapist, it was nice. I mean, he was able to work with kids, he was able to tolerate more. There's one thing he doesn't like, it's noise. And what is a child care center that does not have that? I mean, there's no quiet place or corner in any daycare center. So mine is not an exemption. So we were always noisy. He didn't like that. Also, it was brought in later during the day, so he didn't sleep, but he would trump on kids, you know. I mean, you know, he would go from one child to the other, just waking them up. So we didn't have a happy environment whenever he's around. Anyway, the play therapy really did a good thing for him, okay? But we were back to square one just as soon as the play therapist was gone, okay? Well, it ended up not well with us because there were too many parents complaining about how their children were getting hurt and so on and so forth. And the only choice we had left was to let him go. Okay, so he was transitioned to another daycare, and hopefully he's doing well there. And believe it or not, I mean, you know, it's been really quiet since he's gone there. No kids are crying because so-and-so hurt them and so on and so forth, right? And so it's really, really important that there's a play therapist within Project Karinu. And Jo Beth, and Lavinia, I am very happy to hear that you're going to become play therapists. I mean, we will need you sometime in the future. Thank you so much.
My name is Linda Rodriguez, and I'm the administrator for the Bureau of Social Services, which also takes care of Child Protective Services. Um, Before Project Karinu was even started and you guys got the grant, we had a lot of children that had a lot of issues when we exerted custody. And most of our older children were referred to Ifamagunta or the Guam Behavioral Health and Wellness Center, but there was this big gap where we didn't have anyone providing services for our younger children until Project Karinu came around. So since the program started, we've been referring actually all our children in that age group for services, and it's just been a wonderful program. We've seen our children thriving. Parents are getting support. Our caseworkers work closely with Dr. Lily's staff, and not only are they like an extension of our office, because they just work downstairs from us, but they kind of like keep out an eye on the family, and if there are any concerns, they always address it with us. So it's been a very positive working experience. Especially with Dr. Lily, who's been our play therapist for our younger children. There were a couple of incidents where some children were removed from the home, and it was a very traumatizing experience. I can attest to two children at least that were removed sometime after 6 o'clock. And because our social workers are not equipped to handling mental health issues, I remember this one evening we called on Dr. Lily, and it was way past 6, and she helped us with these two children. And not only did she help us with the children, but also with the parents. So Dr. Lily has been so instrumental in providing all these services to our kids, and we are so grateful to her. And all the staff in Karinu, they're just so excellent. They really work really well with our agency, and we are just so happy to have them with us, and we hope that this program is sustained because we really need it, especially for this age group. Annie and Pinko has done a wonderful job with our older children, but like I said, we need it for the younger age group. Thank you very much.
Thank you very much, Linda. And I hear the passion, you have in your voice, and I tell you, at least for myself, there's no need to convince me that we need to keep Project Karinu. We've been discussing ways to see how this can be sustained. We know that the initial period is through federal funds, and so we're working very hard to ensure that this is sustained and that the services continue to be provided. We a lot of times we always try to we bring to the forefront the gaps in services. But as you shared with us today, it was this gap that we had, but has been filled with the inception of Project Karinu. So these are success stories, and I'm sure as we hear more from the parents, there'll just be that affirmation that this is a program that needs to continue. Absolutely. Thank you. I want to ask Mrs. Ompinko too if she could, say a few words as well.
Yes, good afternoon. I wasn't expecting this at all, but I'll go ahead and say a few things. I'm glad to be here. I support Karinu. I think it's a very important part of the continuum of care for children because, like was mentioned earlier, we handle the 5-year and older, but there's nothing for the younger ones, and that's a very vulnerable time in their life that needs to be really paid attention to. So I fully support Project Karinu, and we do work together with Project Karinu. We do receive referrals from them, not a whole lot, but enough. And I'm glad to see all the families, and I think we should hear from the families. Thank you.
Thank you very much, Mrs. Ompinko. Also want to recognize Senator Uggan, who's joined us here this afternoon. Thank you, Senator. Jason, is there anyone else you'd like to? Yes. Okay, we'll ask Miss Elaine if you'd like to also say a few words, and then we'll have the parents.
Thank you. I'm Elaine Eclevea, and I'm the training and technical assistance, and I appreciate the feedback. When you look at the pyramid, and you're talking prevention, intervention, and intensive promotion, prevention, and intervention. We have a great need in our community, and I appreciate the feedback from Child Protective Services. But if you look at the data, that has doubled over the 5 years or more, and we got to just do something. And so the work that Karinu has done and needs to continue, because our families cannot do that without the support. Toxic stress is all over, and families need our help. Poverty is a big issue. And so, I think your support and the support of the senators, because the kids and their families can't do it alone, and we need to come together to build, like the governor said, a better Guam, but really it starts with providing support to families. We did, the last couple of 3 months, did an intensive building capacity across agencies on trainers that could support families and providers of how to work with infants and toddlers and young children, look at their social emotional development. We have over 35 trainers on Guam, and we did an intensive parent training on the Week of the Young Child. That's just the tip of the iceberg. And so we need to do more and more of that. And it's through support through Project Karinu and the other early childhood serving agencies that type of support has come to Guam. And so thank you for the opportunity to share.
Thank you very much.
Sure. We're saving the best stories for last. But if Senator, if you can allow our family groups, if they'd like to share real quickly, any comments you'd like to add on? Did you, Miss Mary Therese, or
I'd like to take a different take. I've been involved since '99 with systems of care, preparing for all of that with Mary Les and Annie, and worked at Ifamago'ontra and started a family organization. And have direct experience having a child. I attended a conference a couple of years ago that was for children with mental health disorders, and it was a very profound experience for me. I became a parent trainer on ADHD, and so there were some policemen there that were tasked, some policemen from Britain, and I'm not British, but there were some policemen from Britain that were there, and they had been tasked in Britain to help. Children were not responding to normal interventions, and so they were tasked to find out what was wrong and how they could help. And so they
amount of research and got support groups for parents and did all sorts of things for the children. They did something also, children with ADHD, which is a mental health disorder, are excitement seeking. And it's probably one of the reasons that there's more and more children, because sex is exciting. And so children are having children because they're excitement seeking. And last week I was at a school where a principal who's been in the school system for over 30 years was telling me would refer families to us for the support group. She was telling me that she's very, very, very concerned, and she's been in the school system for over 30 years. She's seeing behavior and things that she had never seen before, and she's really worried. You know, she was telling me how we sat down for an hour and a half afterwards and like talked, and she was really worried. And it reminded me about these policemen, because they were saying that you can start telling these children when they're 6 years old, because they start, when they go to school, they start being rejected by children at school, and they start being excluded from programs at school. And so those feelings of rejection start very, very early. You know, they're the children that will blow out the candles on somebody else's birthday cake, or they're the children that will open up the birthday presents of somebody else's. You know, so people tend not to take them. I know here on Guam, when we were started Ifamago'unta, we went to the child care centers and gave 4 child care centers $1,000 for parents to leave their children there. But the children, because they're older, were so naughty that the parents didn't want to leave them with somebody else. And so they don't go to rosaries and they don't do things. But the reality is that it's happening before they're 5 and 6. It's, you know, behaviors, they're the naughty ones in the checkouts, right? And so the parents get looked at and blamed for their children's behavior, when whereas now there's a place for children to go to, for little people, you know, with their little needs being identified, and that's the consciousness of that. So I can't stress, as a parent and as somebody who's worked with families for many years, that we need something for little people that addresses all aspects of their mental health needs. And you know, I brought a picture just so that you can see, because people say all sorts of things about mental health disorders and that they're not real because they're invisible. And so this is what a healthy brain looks like, the top and the bottom of what a healthy brain looks like. And children with ADHD, it's affected this part. You know, they're fabulous at art, and they're fabulous at computers, and they're fabulous at TV. So even little ones,
Okay, so we sought Carino services just about a year ago, and my daughter has an orthopedic impairment, and so we were concerned about her social interaction. We don't have any other kids in the home because of her mobility challenges. She's not able to really interact with her peers, and then she was showing some signs of anxiety in some certain social situations. So we came to Carino, and I have to say, Carino has provided there's just a positive energy when you go into their facility there. But I wanted to tell this the first time we went there. See, so Miana she gets some anxieties around certain adults, but when we went there, she could feel the energy as well. It's very positive. She loved it there. When we were on our way home, she threw a tantrum. She was crying because she said, "I want to stay at Carino," and I said, "What?" And she was like, "I want to go back. I just want to go there and play." And she fell in love with Mr. Ernie over there. And he's really great with her. So I just knew right from the start that it was a good place to go. And I just told her that we can't hang out there all the whole day. People need to work. But with that being said, they have provided a lot of opportunities for her to interact with peers. They have social get-togethers like at Playport. Even just at their offices, they have family work groups, and then they provide opportunities for the kids to do some activities and crafts. They're also very receptive to the parents' concerns in formulating goals and what we want to achieve for our child. And they also have provided some support with the IEPs, individual education plans for the school. So they did support me with that. They even came to our meetings, which was very helpful. And it's not only just with her. I see that they work with us as parents. They provide some training for us. I've gotten the opportunity to go to the National Mental Health Conference, which is a great learning opportunity for parents to just kind of see the big picture of it all. So overall, they focus on the parent, they focus on the child, and I think an important part of the program is the genuineness of the staff and the people. And you can have experts, and you can have people that know everything from A to Z in therapy or whatever the case may be, but to have the genuine interest in the child is a key aspect. So I want Carino to be around for a long, long time, and I think that they have made a great impact on our family. Thank you.
Good afternoon, and thank you for having me. My name is Leon Rohr, and I have been a volunteer with Project Karini's work groups for about 4 years. My son started I started off with geese, and then I went into Head Start, and that's where I was introduced to Project Karinu. I do have 2 children with disabilities. I do work on several other panels, the Guam Advisory Panel for Students with Disabilities. Gosh, I can't remember them all right now. And I also have started a nonprofit organization for families and individuals with disabilities to work with families, because that was one of the things that hit the hardest, is when you find out that your child, has a disability and everything isn't perfect, and that's a hard pill to swallow. And it was hard the first time, but with the second time it was even harder. And that's why I am here. That's why I do what I do, because the feeling I had when I got that those words come to me, and I feel that families need that support. You need someone to talk to. You need some place to go to. You need experts. We need psychiatrists. We need psychologists, and we need them to be available to us and to all of us, because for different levels. Some of us can walk in or go jump on the plane and go to the States, but not all of us. And I don't feel that I should have to move because I have a child with a disability. I feel that certain things should be provided here because I am a citizen here, and I feel that we have to look out for our own. And I've been here almost 30 years. We have a family here. We work here. We live here. We do everything here. And that was the answer people gave me. Well, you might have to move. No, I can't. Everything is here, bless you. And so these things are in need, and they're important. They're on the top of the list, and we need them to happen, and we need to keep pushing forward. You know, I have a lot of kids, but I still find time to do these things because they're important. Because I do get connected to people, and families, and children, and this is where my kids are going to grow up. So they're going to live here, my grandkids are going to be here. So these things need to happen. I'm sorry. It's very hard to talk about these things because we live these things every day, and our children are affected. And we do come here with our hearts in our hands because these are our kids. And 24/7, we're doing this 24/7. We don't get a break. So it is important to us, and we want you to know that it is important to us and to put this on the top of the list. Thank you.
Thank you very much, Mrs. Vore. And I hear you. And that's, we're going to make sure, as like I said earlier, make sure that we continue this. We know that the kids, I have young kids as well. I have three kids. And so I know that when we had our first one, she's 18 years old now, and we have our 7-year-old and then our 1-year-old. But even with us, we see it. If what we didn't do right, or what we thought we could have done better with our first and second, we're doing it with our 1-year-old, right? And so because we know, we're gonna, this is our home. We're gonna leave them and our grandchildren to this island. And so, Project Carino, in providing the services from birth to 5, right, is very, very crucial. Of course, the age, the individuals that Annie also takes care of. That's not too late. It's also very important, but starting them off very young is just as crucial. And so I understand. I do. Thank you.
If we can call, if it's okay, Mr. Chairman, if we can call Ms. Bertha. Sorry.
Okay.
You're
My
okay.
name is Seria Maicon. I have 3 words in my language and in English. And so I'm gonna say thank you for Karinu. I'm not really speak English. Yeah. But what I can talk, I'm gonna say. The 3 language I'm gonna say today in my language, Nephian relationship. And the one, citizen communication. And the last one is Asia non-family evaluation. And I'm a parent for Toson Maicon, my son in Karinu. Before, when I didn't go in the Karinu, they transfer me, maybe I don't know which transfer my son to Karinu. And Hayat Karinu. Karinu very helped me. My son problem, he always banging the head, and always if he like get mad when I make him slow down, he cannot. And very hard to me. And Karinu the one help me to what I'm gonna do my son. And now he really good for now. He go to school and he really good in school. I really happy because he student of the month in school. That's what I really. Thank you so much.
I'm Nellie Duenas. I'm the parent of Draven Tetauto. I just wanted to share how our experiences with our son at the time that he was diagnosed with ADHD. At the age of 2 years old, our son Draven has had an unusual behavior that both myself and Manny, his father, along with other family members, were concerned. One day I took my children to the immunization outreach that was held at the Stumbo Center.
and was curious to find out what the program was about. I met with a beautiful lady, Miss Lolita, who was more than beautiful, more than happy to assist me with what was more than happy to assist me, and was able to let me know what the program had to offer. Miss Lolita was able to have. Miss Lolita was. Sorry, Miss Lolita was what. Miss Lolita was able to have me fill out documentation to know, or to documentations to how I could be contacted. In less than a week, I was happy to receive a phone call from the program and spoke to Miss Hope. Miss Hope has scheduled appointments for myself, Draven's father Manny, and along with our son Draven, to come in for some kind of evaluation. Throughout the evaluation, our son had seen Dr. Lily. Dr. Lily was there throughout the whole time to assist us with some play therapy. That's how we knew that our son was diagnosed with ADHD and a severe anxiety through play therapy and a 6-month evaluation. Project Karinu has been such an awesome program to seek for services for any state of services needed. Project Karinu has made a big positive impact in our family. Not only does the program only care for our son, but also for our family. Draven, Draven was really loved by every staff that was there. Every time Draven was there, he would always mention how, Mom, can I just stay with Miss Loli? Where's Miss Loli? Miss Loli was his tell. So I honestly think that Project Karinu should continue their services and support to other family members that need the services.
Hi everyone. My name is Manuel Tatautau, and I'm the father of Draven. I just like to say a few things. With Project Karinu, they had given us the opportunity to actually go out on a seminar, a convention, 2 years ago. With that being said, between Nelly and I to actually cope with a child who's got ADHD and severe anxiety, we had struggles. We're both working parents, both go to school, college. To actually cope with a child that has ADHD, it all start with the parents, and we've had seminars where we've gone through to, parenting, and we did it voluntarily. We came to Karinu voluntarily. It was so hard. It was hard hitting for us, knowing that Draven is our youngest out of 4 children, and to have your youngest with disability, it's like you were saying, you like to do everything that you couldn't with your first and second, and make it to your last child, your youngest. So, we just like to extend our welcoming to Project Karinu. They've made a big positive impact, like Nelly said. Draven is one of the first children to actually complete the program. And I wish they actually can go up to 6 years old instead of 5. From 0 to 6, and 21. I mean, it's but yeah, even though we're not in the program anymore, Draven's not in the program. We still tell, Dr. Lily, Mr. Terry, that's not with us right now, Mr. Jason, Miss Hope, and everyone in the Karinu. They're just extended family. We still offer to come out and speak, as the voice for everybody, because Thank you very much. Again, I tell you, God is good, and so this program has been a blessing, really. So I think, and if I could just highlight in your story is that you said you did this voluntarily. You just mhm. Oh sure, no, but even the when you got into the program, that's you saw it at a yes, that's right. Mhm. That's right. Yeah, yeah,
And I must admit, with the evaluations, and I'm pretty sure a lot of other people, we have taken up to almost 4 hours to do every 6 month evaluation. But I like the parents to take their time out and seriously continue with it and not opt out. You know, it is hard to stay there in a room um, with the person giving the evaluation for 3.5 hours, but it'll only be good for your child. You wouldn't be seeking the for the program or for the help if your child didn't need it. So think about it, guys. Parents, if you guys can take the time out to actually fulfill that evaluation, it'll help the program as well. It's not just us sitting here and talking about the program, which is a few, you know. So yeah,
great.
I just like to emphasize that.
Great, thank you very much. And this is what started us the planning to get us into this room today. Was we were talking with Terry, Miss Annie was there, Jason, and we wanted to because we're here we hear about the success stories, right? But we wanted to get it out to the community, and you're the perfect examples of you weren't referred by anyone else. You were at a immunization, and so you saw, and we always, every time we get the opportunity, when we have an event or something, we ask Jason and the group to come out and have a display table so people will know. And so now we know those work, and so we got to now we have to reach out to others.
Really, just going out to the big happenings. Let's say Relay for Life. All the big happenings where everybody's there is the best way to actually advertise it and just get it out to the people.
That's right.
Yeah, Project Karinu. This, like I said, Draven will always want to come back. Even if he's 6 years old, he'll be 7, but he'll always want to come back. Everybody's it's just at home,
Yeah.
It's really, I can't express more than just saying it's home because ain't nothing better than home.
Great. Thank you so much. Is there any other parents that are here that would like to also come forward? We have some. Okay. Oh yes, right here. I'm sorry. My assistant has been so quiet here, so I'm gonna ask Jimmy and his foster mom to go ahead and share their story as well.
Okay, Jimmy, say hi.
Hi.
Okay. Jimmy is a success story for my family and I. He has been such a great joy. I usually don't. I usually speak well in front of public, but this is it touches the bottom of my heart. In the beginning, this Jimmy would not even say hi. He'd just be, cowering, and just to sit next to you, Senator, was not possible. Okay, Project Karinu has really helped Jimmy and his family, his mom and his dad, and he has a brother also. And when I first became a foster parent, I have a son of my own, and I would say that he's very fortunate to have a mom like me. So when I was younger, I really wanted a lot of kids, but for some reason, God just gave me one. And I think I understand now why I just have one son. Because maybe down, in the future, maybe I'm supposed to share my love to other kids and to try to help them succeed in life. And to me, Jimmy has succeeded. Um, he has become a very great part of my life. And if he should ever go back to his mom and dad, I'll be very happy, you know, because it's something I know that we did for him to help succeed in life. And we'll be very happy. I will continue as a foster mom to help him succeed in his own life. He'll be going to be to kindergarten next year, and he's following me. I'm an educator. I'm over at Agania Heights Elementary, and I've already started because I know Jimmy's limitations and I know what he can and can't do. So I've already started transitioning him. Everybody at Agania Heights loves him, so I don't know how that's going to be when he starts school. So I've already instructed them, let him be, you know, let him be a student. Please, you know, don't enable him because we've worked so hard. But the reason Jimmy went to PNG was because one day, like you said, Senator, they had these outlets, and we saw, I observed, and I observed Miss Stella's workers there, and I saw that they were really, really good with the kids. And I said, that's the daycare that I want Jimmy to go to. And that is why he's going there, and they've really helped him. Great, you know, they helped him a lot with his socialization, and Karinu had a great part in that too. Jimmy now can talk, right? Jimmy, you can talk, right? So everybody have a nice day.
Have a nice day.
So he's such a joy. Karinu has also assisted us in helping out with a lot of his medical issues. He still has a long ways to go, but you know what? Every little step is a success. And I'm really urging, Senator, that you really push on keeping Project Karinu alive, and like Mr. Tatauta says, maybe extend it to 6, 7 years old, because they really, you know, they need that. I'm so glad that Project Karinu is around, because now, as an administrator, I have somewhere to go to. You know, I have somewhere where I can refer these kids to, or just to call and ask questions to help me out with other kids. And that's where Project Karinu will really assist us on our island, helping parents. That's another thing, helping parents. They've really helped parents a lot. They've not only helped them, assisted them in finding ways to help their child, but they've also educated them. And that was, you know, that's a big thing for me. When you educate a person, it helps them to help themselves. So please, I'm really, 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 really asking you, keep it around, keep Project Karinu around, and keep the wonderful people. They really have a big heart. You know, somebody said something over here where it's not just a pretense. Was it you, Miss? Yeah. It's genuine. You know, it's the true love, the real love. They are in this because they love the kids. And I would testify to that. Thank you, Senator. You want to say thank you, Jimmy?
Thank you.
You want to tell them what book you read? Can you tell?
What story? What story?
I love
What's the other one?
my heart
Little Red Riding Hood. How about the other one?
and a wolf.
The Angry Wolf.
The wolf.
All right. Good job. Thank you.
Thank you.
Go ahead. You should please come up, ma'am. Afternoon. Yes.
Hi. Hi, my name is Girlie. I'm parents of two kids with disabilities as well. First of all, But the thing is, when I went to Karinu, first and foremost, I went to Marriott Hotel to go to GIS program because my other son went there and they asked me to go for a seminar. But because my daughter is sorry had a disability as well, I don't know where to go. So when I saw Miss Lolita, sorry. So when I saw Miss Lolita at the Marriott Hotel, I asked her if they can help me with my daughter. So they said that I need to go here and there to verify if her eligibility for that, for Karinu. So I went there. I just want to know if they can help me with my daughter because it's really hard knowing you don't know where to go. Even though my son is with GIS program, but it's hard to think who's gonna help me with my daughter, raising with a child with a disability. Luckily, I went for that conference at Marriott, and I saw Miss Lolita and helped me all of these things. So when they said that I'm eligible to see Project Karinu, I'm really thankful, and they helped me. Now my daughter can speak through language. Yes. And I'm really saying, please help Project Karinu to be there as long as it could be. Yeah. Thank you.
Thank you so much. Thank you. We've been hearing a lot of the success stories, right? And so we hear about and maybe for the people who are at home watching, people who will watch this later on, Project Karinu. Maybe Jason, you can talk a little bit more about it. Is that it's and I mentioned it earlier. It's a federal program that was as a grant for about 6 years, right? 6 years, and we're in our fourth year now. Fifth year now. And so talks have been happening. We're working very closely with Terry, with Jason, and everyone there, and also with Mrs. Ompinko, and ensuring that this service continues. The Project Karinu continues, and so it's going to be absorbed by, of course, the resources that we have locally, and that's what these discussions are being talked about now, because I know, and it just your stories today of sharing the stories just is that reaffirmation that it needs to continue, and we will. I know for myself, I'm going to make sure that we work very hard to find a solution to make this continue. I'm sure Senator Agan as well and the others would feel the same way, right? So rest assured that we're going to work very hard because the success stories you share, other people are going to need this as well. And so that's the way we're going to make our island that special place, right? We've got to take care of our kids and our families. So thank you. Jason, you want to? I think Mary Liz, please.
In the end, the family stories are the most crucial evidence, I guess, because the outcomes, their satisfaction, what they say they received that they needed is what is the testimony to why we need this program. But on a systems level, I wanted to emphasize also that besides the services being brought to the families, Project Karinu is about systems change, and it is a part of the early childhood initiative that's been rooted also paying attention to all the rest of the needs of the children. And I wanted to point out as a system change, because we all know it's a difficult thing to change the way government or services operates. But there's been really great strides, besides the fact that we now have social workers with IMFT licensures who specialize in work with children. There's been a lot of other training provided through the training component, the technical assistance component of the project. We have a lot of families who are more able now and willing to come out and express their voice in the decision-making processes. So I guess what I wanted share was 14 years ago when the System of Care initiative started to become uh, something that we were recognizing we needed in Guam. There were parents like Mary Therese whose children were already older who said, this is already too late, but we will keep working at this because there's so many behind us that didn't that need to have the opportunity for that help the way our kids may not get, right? So already 14 years ago we were too late for many other children. Now we have the opportunity to really make this happen for children that are around who are younger. And I'm just thinking about the fact that as we're successfully infusing the knowledge and the values of system of care approaches in public health, we need to infuse it further in other arenas. And it's going to take the really the involvement and the courage of the families to come out and be with us. Because it really, besides the services you're getting, it's about changing the way we do things in a bigger scale. And we have some history to show that it's been successful in the early childhood arena. So I just wanted to really emphasize that piece. The other thing is 14 years ago, we did not have local children's mental health data. We do today, thanks to the initiative that was put into effect.
This particular slide, when Bonnie showed it to me, it made me cry. And I just need to share because this is, it's data and it's local data, as Mariles was sharing. And this is at clinical range. So if you think about the kids that come through and we do the screening and we try to figure out, okay, so like, where are they? So at intake, you know, if we look at the numbers at intake and a year later, I'm happy to say all the numbers dropped. Meaning to say, it's less of a problem. So it was like a 37% problem at intake, it's down to 11. So across the board, sleep problems dropped. Withdrawal, we talked about social anxiety, from 43 down to half, more than half, 20.3%. Somatic complaints, these are the kids that I don't feel well, and if you take them to the doctor, they're fine. From 17 to 3%. We look at anxious, depressive behavior from 23 down to 11%. Attention problems, we talked about ADHD from 40% down to 29%. And aggressive behavior from 37% down to 20%. So this is the time we need to have the intervention before they get to DYA, before they get to DOC, so that it's no longer a problem. They learn to self-regulate. We give parents a supportive, you know, whatever they need, the coping skills, the information, the support system, so that they can do a better job parenting their kids, because then their kids, when they become parents, will be better parents, and we pay it forward. So I just wanted to share, this is one of those slides that really captures it all, totally local data, and it's research based. So I want to say, you know, we're not just looking at something that's evidence based, it's research based, and it's grounded here at home. So I want to just say thank you. Thank you for your time. Thank you for the parents who have come out and shared. Thank you to the team who have really helped to highlight, you know, the impact that we've had and that we can continue to make.
Thank you, Dr. Lily. And just to end on this note is that we've have passed legislation just very recently that already starts the process of ensuring that this program is sustained. Right? We've the reevaluation of real property on Guam is going to be happening, and so from that reevaluation, the legislature has dedicated a certain percentage of resources that would go towards ensuring children's mental health, and also, of course, Project Karinu is involved, is sustained. And so that's a start. There's still work that we're working with, with Annie and in public health as well. so the process is moving, and so the recognition is there already, and so we're going to make sure it continues. Okay, so thank you, Dr. Lily, Jason, and to all our providers and all the angels, right? All the blessings. So thank you so much again. Jason, you want to close, or Ms. Pico, do you want anything? Do you have anything?
Well, Senator, thank you again. And I know this is one of what we hope will be many conversations with our elected leadership. There is obviously a lot more work to do, to be done in the months ahead. And we, on behalf of our families, our staff, want to extend to you and your office and the legislature for this opportunity to share information and hear firsthand from the people whose lives were affected in one way or another. Personally, if I may share, the families, thank you so much for taking time out of your schedule. Thank you for bringing your children down here. This is important. This is important to you, but this is also very, very important to us as we know firsthand that this program means a whole lot to you and to the many families that have yet to come through our doors. So, Senator, thank you so much for this opportunity. Senator Ruggan, for listening to our families and our partners and our team here.
Great. Thank you, Miana. Thank you very much for coming here today, okay? And also to Jimmy and to all the kids who are there. And you guys can go get your pizza now, too, okay? So thank you. So just want to say God bless. Thank you.